Oklahoma's most vulnerable citizens, those who are most frail, in nursing homes and long-term care facilities is a top priority for AARP Oklahoma. That's why we are endorsing Senate Bill 1289 in our current law, where people who have been convicted of serious crimes are able to work in long-term care facilities. This bill is necessary to correct that loophole in our law.
Absolutely. I think one of the things that's important for us to look at is what we can do to protect seniors in any instance we can. And there's a little loophole in the law that needed to be closed. Mainly that we need to be able to make sure that people who have committed violent offenses, especially those against senior citizens, aren't allowed to just come back in because they get a deferred sentence. What this bill does is it basically cleans up language that says if someone's convicted of a violent crime, they can't get a deferred sentence, which is a prosecutorial tool to allow that person to plead guilty and then get out of the conviction later if they are on good behavior for a certain amount of time. If they've battered somebody, if they've sexually abused somebody, they may qualify for a deferred sentence, and if the criminal justice system wants to treat them that way, that's fine. But employers in the healthcare field, especially in our senior areas, adult daycare, nursing homes, they need to know if somebody has pled guilty to a rape or to assault and battery on an elderly person. They need to know those things. And so what Senate Bill 1289 does is it cleans it up and hopefully closes that loophole so seniors have better protection.
My mother was in a nursing home facility in Craig. After investigation, I found out that a certified nurse aide that worked in my mother's facility had 3 caretaker abuse convictions out of Fusky County in 2003. She pled guilty to those 3 convictions of caretaker abuse, but received a deferred sentence. I believe State Bill 1289 will cover the loophole that's in the Oklahoma law that pertains to certified nurse aide or the nurse aide registry and individuals being convicted and receive deferred sentence or plead guilty or no longer.
I would hope that it would receive widespread support. It got a unanimous vote in committee today. Senator Coates is the main author of it. I was pleased to carry it on his behalf today before the Health and Human Services Committee. I would anticipate it would go to the full Senate fairly quickly, and I would hope that my colleagues here would be more than happy to support it.